Local healthcare professionals say Screen and Stay will help keep more kids in the classroom without adding much additional risk. News 12 Connecticut's Sean McCabe spoke with one doctor about the initiative.
Maintaining in-person education and learning for the children in the state is really a priority, and that's something we've seen over the past 18 months.
Dr. Scott Roberts is an infectious disease specialist with Yale Medicine. He says recent studies suggest it's safe to keep kids in school after low-risk contacts.
When teachers and staff are able to monitor the children and see that 6 feet of distance was maintained, the kids were appropriately wearing their masks, the risk of COVID transmission in that scenario is really low.
Out-of-school contacts will still require quarantine. Roberts says it's much harder to gauge risk during extracurriculars or at home.
At a dinner table, for instance, where there's unmasked to unmasked contact for greater than 15 minutes and many times hours at a time, those are scenarios where it's much more likely to get COVID or transmit it to another child.
He expects transmission numbers in the classroom to come down even further as school-aged kids start getting vaccinated.
And right now, I think the biggest risk we all fear in schools is that every classroom is full of unvaccinated people in these age groups.
Roberts says at least until vaccine numbers come up, masking young kids in schools is still a good idea.
Even vaccinated individuals are still able to transmit the virus. And so for that reason, we're recommending masking in indoor spaces, especially in high-risk settings.
The decision on whether to opt into Screen and Stay being left up to local school and health districts.
And a lot of that is what resources do they have? What's the current rate of COVID in the community? Are they able to supply masks? Are kids able to quarantine if they do get exposed?
Sean McCabe, News 12, Connecticut.
Greenwich Public Schools told News 12 they plan on adopting Screen and Stay later this month. They say they're being extra cautious and making sure plans are in place.